Hi, in this video we will be seeing Orem's nursing process application. Already I have discussed Orem's theory in other videos. In this video we will see how to apply Orem's theory in clinical practice. You should have an understanding of Orem's theory before going through this video. So kindly go through those previous videos on Orem's theory. Now let us see our condition. The patient with fatigue has approached a nurse. So how we will be using this Orem's theory for this particular patient we will see. Try to remember the different concepts in Orem's theory which consist of self-care, self-care deficit and nursing systems. The self-care includes self-care agency, self-care requisite, therapeutic self-care demand. All this is for the dependent care also. And if deficit is there, nurse will be doing help in 5 methods. And nursing system is divided into wholly compensatory, partially compensatory and supportive educative. Hope you have a clear understanding of all these aspects. Otherwise, please go through the previous videos on Orem's theory. Now let us see the condition of the patient. When you are seeing the patient, we have to collect the data from the patient. The first part is the assessment. Assessment basically we have to consider regarding the basic conditioning factors. Please do remember what all are the basic conditioning factors on which you will be collecting data. Here, age is 42 years, sex female, the developmental state adulthood, the pattern of living, the patient is an office assistant, from that you understood it is a sedentary work. The family system factor, 3 children aged 5, 7 and 9 years, her husband is a clerk and financially sound. Socio-cultural factors, you need to talk about the religious practice or cultural practices also, because various education regarding the nutrition or any other thing will depend upon the cultural practices of the patient. So you need to ask about the religion, and the patient says go to worship occasionally, has education of graduation level. The cultural factor is very much important. Health state. Has type 2 diabetes diagnosed more than 5 years ago. Except for periodic fatigue, she managed the condition by following a therapeutic plan, taking an oral medication and checking blood sugar once per day. However, because of fatigue, she can't exercise often. Today, the glucose level is 230 mg per dl. Health system. Family has got a health insurance. Availability of resources. She has access to the community health center. External environmental factors, has a safe neighborhood. Her perception of her health status. She has concern about her weight. She has the desire to lose weight but finds healthy food too expensive and she eats snacks late at night. Her weight is 85 kg and her height is 158 cm. She is obese. So these are the data which we collected during the assessment regarding the basic conditioning factors. Next, you need to question her regarding her self-care practices. This is another concept in Orem self-care. So you need to question on that part. So when you question, you understood the patient is on oral medication for diabetes and also the patient checks glucose level frequently. Now moving on, therapeutic self-care demand. With that only we can do the goal and planning. In therapeutic self-care demand, you might have thought about self-care requisite, universal self-care requisite, which is 8 in number. Next, according to the developmental stage, developmental self-care requisite are there. And third is when a patient is having or a person is having health deviation, at that time health deviation self-care requisite will come. Here, if we are thinking about the universal self-care requisite, the patient has no problem with the food, water or elimination, but she has a problem in prevention of danger of self. For a diabetes patient, you know that there are danger for self. So she has to understand certain factors. Otherwise, it can result in complications. So self-care requisite. One is we have to reduce and maintain the blood sugar level through glucose monitoring, eating a healthy food and increasing activity. These are the needs. This in turn will reduce the weight that again will motivate her to engage in self-care. So these are the self-care requisites or the self-care needs our patient is having. Also, our goal is to set the glucose level to 100 to 110 mg per deciliter. So this is our goal. Today the patient has come with 250. Now as a nurse we are setting the goal along with the patient it should reach within the range of 100 to 110. And for that planning we will be doing monitor the level of glucose 2 times per day. She was just monitoring 1 time and adjust activity and also plan a meal. So these are the goals which we are setting along with the patient in therapeutic self-care demand. Next, our therapeutic self-care demand is making a healthy food choice. So we have to seek knowledge from a dietitian for that and adjust grocery budget to purchase affordable healthy foods, and the patient has to eat a balanced meal. So these are all things which are therapeutic, which are good for the patient. The third goal planning is to increase the physical activity. So for that we can tell or plan, perform a step walking program for the patient, use a properly fitting footwear and increase the steps in walking. So these are the plans which we can do for the betterment of the patient. Next, self-care agency. You know that self-care agency means the capability, the ability to seek and obtain required resource for each action. First one was the monitoring blood glucose. So at that time, what is the capability the patient should possess? The patient possesses the necessary capability of knowing, deciding and performing blood glucose testing. If the patient is not knowing, we have to teach. Now the patient knows, so we have to see how she is performing. And she is aware of the effects of food and exercise. So how she will be controlling the meal, how she will be going for activity. We have to increase the awareness. That is the capability the patient is having. These two, the patient is capable. The nurse can conclude patient self-care capabilities to meet self-care requirements are intact to maintain blood glucose to the desired level. Here for this particular patient, her capability is good. Then regarding the dietary practices, the patient from her conversation shows she has misinformation about food selection and is not aware of her dietitian. So she ingests all food types. So here the capability is less. For the third aspect, she enjoys walking along with kids, but she is not aware of the footwear she has to use. Here also the capability is less of understanding. So you need to educate the patient. So you need, when we are applying the Orem's theorem, you need to have an understanding. The nurse needs to have an understanding of the capabilities of that particular person. Now, self-care deficit or self-care limitations the patient is having. The patient lacks knowledge about the purchase of healthy food. She is not enrolled in any dietary classes, and related to food care she has limited knowledge. So these are the deficits the nurse noticed. Next, nursing agency. So what are the calibers of the nurse? So nurses, basic conditioning factors you have to see. Nurse holds a master's degree and has been working in a diabetes clinic for the last 4 years. So we understood the nurse is capable enough to provide care for this particular patient. Next is nursing system. In this we will be implementing the nursing action. You know the different methods of helping. 5 methods of helping are there, and here for this patient she just needs guiding and directing, teaching and psychological support. No need of action from the direct action from the nurse's part. And when we are seeing the nursing system, it should not be a wholly compensatory. The patient is not bedridden, no need of giving the entire care to the patient. It is not even partially compensatory. But here the nursing system is supportive, educative. Then evaluation. Actions are carried out until nursing is no longer required. You have to evaluate whether the client has reached that self-care ability. So that is what comes in evaluation. So this is Orem's self-care process. You might be remembering first assessment part, which includes finding or collecting the data about what self-care the patient can do, what are the self-care deficit. If there is a deficit between self-care abilities and the demand, then only nursing is required. So assessment part is very much important. And in the assessment again you have to understand what is the reason for the deficit, what the nurse can do. So when all these things we are getting answer for all this, we are moving to the planning stage and thinking about what all goals we will be setting along with the patient and what type of nursing system we can provide, whether it is wholly compensatory, partially compensatory, supportive, educative. Then implementation, what are the different or 5 ways of helping the patient. Last, evaluation. Formative evaluation, summative. Formative evaluation, whether the client is able to re-establish self-care. Summative evaluation also we have to do. How effective is Orem's self-care model in delivering self-care in this particular nursing specialty. So this is all about application of Orem's theory along with a patient. Please do subscribe to this channel for more videos on nursing. Thank you.